Alright, so I'm going to be showing you how to perform a closed basket taping technique for an inversion sprain of the anterior telafibular ligament. So after checking to see if it's an interior or inversion or an eversion, the first thing you want to do is apply an adhesive spray to the ankle. This will allow the pre-wrap to go on easier and stick to the body. So first you spray on both sides. If you have any bony prominences like behind the ankle or in front, you can apply these pads. So I'll be doing that as well as adding this pre-wrap to the ankle. And it doesn't have to be a lot, but just in the areas that you know that you're going to be taping over, you want to add this pre-wrap so then the tape will stick to this rather than the ankle. So you can go on the ankle, you can go under the foot, just all around the spots that you'll be performing the taping at. So once you have that on, then we can begin with the actual tape. So the first thing you want to do is apply anchor strips. So you're going to do one, and actually I'm going to put a little bit more pre-wrap on in order to get it a little bit higher up the leg. So we can go up a little bit higher to where we want to begin. So we're going to perform anchor strips on both the top and the bottom. So I'll go all the way around and get this nice starting spot here with the tape, as well as down on the foot, just like this. So now we have our anchors set. The next thing after setting the anchors is applying a stirrup. This will start from the medial and go around to the lateral because of this inversion sprain. So starting at the medial right here, we're going to go from the side all the way down and around and back on the outside part of the leg. Okay, so we have our stirrup. Now we're going to perform a horseshoe, which is going to go from the medial to the lateral side of the foot, and the horseshoe goes around the back side of the ankle. So from one stirrup all the way back and around to the other side. And that completes one set of the stirrups plus the horseshoe. And so what we're going to do is now perform two more of what we just did. So another stirrup, starting here on the medial side, around, up onto the outside lateral part of the leg. So there's the horseshoe, and then we're going to do another, or that was the stirrup, and then we'll add in that horseshoe for the second time, and we'll do it one more time for extra support. So from the medial around to the lateral side for the final stirrup. Make sure that's set, and then after that's set, we'll finish off by going one more horseshoe strip around the back. So now we have 3 of the horseshoes and 3 of the stirrups. This will keep it nice and secure. After putting 3 of each, then we're going to move on to enclosing the entire leg with tape. This is going to be in horizontal strips going from the bottom up to the top. So what we're going to do is just start down here by the heel, go all the way around to the front side, and just continue this all the way up until we enclose the entire thing with tape. Well, one more up to that top part. Now we have it all fixed up. The final thing we're going to do is we're going to go one heel lock from each side. So we're going to start here at the front, go around the heel just like this, and back up to the top, going one way, and then we'll finish going the opposite direction. This is going to go around that heel, just like this. And now we're done. All right, so when rehabbing from an ankle sprain, specifically an anterior talofibular ligament, there's a few things that we can be doing on a daily basis or weekly basis. So I'll give you two things that we can focus on in order to regain strength as well as maintain flexibility in our ankle joint. So these things, both of them can be done about 3 or 4 times a week. So we'll start with this first one here, which is basically, so we're going to use a cone, set the cone on the ground. Some would say it's a one-legged squat, not necessarily getting as deep as a regular squat, but what we're going to do is have her stand on one foot, which is the foot that we're rehabbing. Keep the other one either back or in front, and what she's going to do is bend down nice and slowly. You can bend the knee until you touch the cone, and then just straight back up. So what this is going to do is it'll help us with our balancing. It'll help strengthen all those little muscles around our ankle in order to regain that strength that we had before the injury. So she's doing about 8 to 10 reps. She'll do 8 to 10 in a row, give a little bit of rest, and maybe do 2 or 3 sets of this. So there's not one exact set or amount of reps that you have to do, but 8 to 10, maybe 2 or 3 times, 3 or 4 times a week. So continuing to strengthen those muscles with this movement. The second one that we're going to do, you need a towel. You can use a shirt or a blanket, really anything that you have. What you're going to do is sit on the ground. So she'll sit down with her feet out in front of her. She'll grab this towel, and what you're going to do is put it around your feet. You can put it around both toes, or really just the one that you're rehabbing. So you'll have a hand on each side, and what she's going to do is pull back that toe in order to get that flexion going. And what she's going to do is try to hold it for about 15 seconds. Really feel that stretch out, and after about 15 seconds, she can release and go back to a comfortable position, rest a little bit, and redo this for 2 or 3 times as well. So she can do this also about 3 or 4 times a week. Just really stretch out that ankle. You'll stretch out the Achilles on the back and get that mobility back to how it was before the injury.